All right, gentlemen, let's talk about the prostate. That walnut-sized gland hanging out near your bladder. Yeah, that one. Before you ask, no, it's not some kind of evolutionary leftover like that weird little toe you never use. The prostate has a job, believe it or not. It makes some of the fluid in semen, which, as you know, is essential for, well, think of it as the unsung hero of the reproductive system, quietly working behind the scenes. But like a tired old stagehand, sometimes the prostate can start acting up. And one of the ways it does that is with prostate cancer. Don't panic just yet. We're going to break it all down, from what causes it to how to keep it in check. So grab a beverage, get comfortable, and let's talk prostate health. So, what happens when the prostate goes rogue? Imagine cells in your prostate multiplying like rabbits on a caffeine bender. That's cancer in a nutshell, uncontrolled cell growth. Now, not all prostate cancers are created equal. Some are slow-growing and harmless, like that one friend who's always running late. Others are more aggressive, like a telemarketer who just won't take no for an answer. The good news? Prostate cancer is often treatable, especially when caught early. But to catch it early, you gotta know what you're dealing with. That's why we're here, folks. Knowledge is power. And in this case, it might just save your, well, you get the picture. Okay, let's talk risk factors. Prostate cancer isn't something anyone wants to think about, but understanding the risks can help you stay ahead of the game. So, who's most likely to get a visit from the prostate cancer fairy? It's not as random as you might think. First up, age. Sorry to break it to you fellas, but the older you get, the higher your risk. It's a bit like a ticking clock. Time keeps moving, and so does your risk. Think of it like this. Your prostate has been working hard for a long time. It's bound to have a few glitches eventually. Just like an old car, parts start to wear out. Family history plays a role too. If your dad or brother had prostate cancer, your chances go up. Genetics, you tricky devil. It's like inheriting a family heirloom you never wanted. Then there's race. African American men are at a higher risk than other groups. This isn't just a statistic. It's a call to action for better awareness and screening. Why? Scientists are still trying to figure that one out. The research is ongoing, and every day brings us closer to understanding the why behind these numbers. And of course, lifestyle matters. Diet, exercise, smoking, all those things your doctor nags you about? They count here too. A healthy lifestyle can make a big difference. The bottom line? While you can't control everything, there are things you can do to lower your risk. Small changes in your daily routine can have a big impact. More on that later. Stay tuned. We'll dive deeper into what you can do to protect yourself and stay healthy.
Okay, let's talk about checkups. They might not be the most exciting thing on your calendar, but they are incredibly important. I know, nobody likes going to the doctor. It's one of those things we tend to put off, like doing taxes or cleaning the garage. It's like going to the dentist, but for your insides. You know it's necessary, but it doesn't make it any less daunting. But trust me on this one, folks. Your health is worth it. Remember how we said early detection is key? Catching issues early can make all the difference. That's where checkups come in. They are your first line of defense. They're like those annoying smoke detectors that go off when you burn toast, but for your prostate. Annoying, but potentially life-saving. Better safe than sorry, right? Peace of mind is priceless. So, what can you expect at a prostate checkup? It's not as scary as it sounds. Well, there are a couple of things your doctor might do. It's all pretty straightforward. First up, the PSA test. It's a simple blood test. PSA stands for prostate-specific antigen, which is a fancy way of saying a protein your prostate makes. It's a marker that helps doctors understand what's going on. Elevated PSA levels can be a sign of prostate cancer, but not always. It's just one piece of the puzzle. Think of it like this. The PSA test is like a first alert. It gives you a heads up that something might need further investigation. It tells you something might be up, but you need more information to know for sure. It's a starting point, not the final answer. And that's where the next test comes in. Your doctor will guide you through the process, step by step, ensuring you get the care you need.
Okay, I know what you're thinking. Digital rectal exam? You mean exam? Yes, that one. But before you sprint in the other direction, let me explain. A digital rectal exam, DRE, is a quick and relatively painless way for your doctor to feel your prostate for any abnormalities. Look, I'm not going to sugarcoat it. Nobody having a finger inserted into their rectum. But it only takes a few seconds and it could save your life. Plus, it's a great story to tell at parties. Just kidding, please don't do that. The point is, the DRE, combined with the PSA test, gives your doctor a better picture of what's going on with your prostate. And if they find something suspicious, they can order further tests to confirm or rule out cancer.
So, the PSA test and DRE raise some red flags. These tests are often the first indicators that something might be amiss with your prostate health. Now what? Well, the next step is usually a biopsy. This might sound daunting, but it's a crucial step in understanding what's going on inside your body. Don't worry, it's not as scary as it sounds. Many patients feel anxious, but knowing what to expect can help ease those fears. A biopsy is simply a way to get a small sample of tissue from your prostate so it can be examined under a microscope. This helps doctors get a clear picture of your prostate health. Think of it like this. Imagine your prostate as a giant chocolate chip cookie. Just like you might take a small bite to check for chocolate chips, a biopsy takes a tiny sample to check for any abnormalities. A biopsy is like taking a tiny bite of that cookie to see if it contains any unwanted ingredients. It's a small but significant step in diagnosing potential issues. The procedure itself involves using a thin needle to extract some tissue samples. This might sound uncomfortable, but it's generally quick and straightforward. It's usually done under local anesthesia, so you won't feel much. The area is numbed to ensure you remain comfortable throughout the procedure. A biopsy is the gold standard for diagnosing prostate cancer. It provides the most accurate information about the presence and nature of cancer cells. It allows doctors to determine not only if cancer is present, but also how aggressive it is. This is vital for planning the most effective treatment strategy, and that information is crucial for deciding on the best course of treatment. With accurate biopsy results, you and your doctor can make informed decisions about your health and future care. Okay, so you've been diagnosed with prostate cancer. What happens next? The good news is, there are a lot of treatment options available, and the best one for you will depend on a variety of factors, including your age, overall health, and the stage and grade of your cancer. For some men, especially those with slow-growing cancer, the best approach is simply watchful waiting. This involves regular monitoring to see if the cancer progresses. Other treatment options include surgery to remove the prostate, radiation therapy, hormone therapy, and chemotherapy. In some cases, a combination of treatments may be recommended. The important thing is to talk to your doctor about all of your options and choose the one that's right for you. It's your body, your health, and your decision.
Receiving a prostate cancer diagnosis can be scary, but it's important to remember that you're not alone. There are millions of men out there living with prostate cancer, and many of them go on to live long and fulfilling lives. The key is to stay informed, stay positive, and stay proactive about your health. Eat right, exercise regularly, and talk to your doctor about any concerns you have.
And don't be afraid to reach out for support. Talk to your loved ones, join a support group, or find a therapist who specializes in cancer care. Remember, a prostate cancer diagnosis doesn't have to define you. You're still you, and you've got this.
So there you have it, folks. Prostate cancer 101. It's not the most glamorous topic, but it's an important one. The more you know about prostate cancer, the causes, the risk factors, the symptoms, the screening tests, and the treatment options, the better equipped you'll be to make informed decisions about your health. And remember, early detection is key. So talk to your doctor about getting screened, especially if you have any risk factors. It might not be the most fun conversation starter, but it could be one of the most important conversations you ever have. Take care of your prostates, gentlemen. Thanks for watching Akuko TV. Like, share, and subscribe. And until next time, stay healthy, stay informed, and stay awesome.